are 4 things I can tell just by looking in your mouth. I'm Emma and I'm a dental hygienist. Yes, we can tell the really obvious things like smoking or if you don't brush your teeth very well, but here are 4 things that you probably don't think that we know. 1, I can tell whether you're left-handed or right-handed, and even more so when I use plaque disclosing gel and highlight the plaque in your mouth. Most left-handers brush the right side better and most right-handers brush the left side better. Reason being, it's easier to brush on the opposite side, so there's always way more plaque on the side of your dominant hand. I can also tell what side you favor with eating. A lot of people don't think they have a side, but most people do, and I can tell because there's way more plaque and calculus that I'll clean out of one particular area, on one particular side of your mouth. And if I ask someone, do you favor chewing on their right hand side, they'll actually think about it and say, oh yeah. How can you tell? Because I just picked a whole heap of chicken out of your lower right hand side molars, Bruce. You may have a sleep disorder. Now there are usually telltale signs and people will usually tell us certain symptoms they're experiencing or they're not waking up in the morning feeling refreshed. But I can also tell if you have a really large tongue that may be blocking the airways. I can also tell if you've got a scalloped tongue, and there are a few other really clear clinical signs that indicate a sleep disorder. And lastly, number 4, we're usually the first people to identify whether you've got an oral cancer or STI. Now, a lot of oral cancers show up in the mouth really obviously. And if you think about it, if you go to your GP, they're not asking to look inside your mouth usually, or when they do, they're looking at your throat. They're not looking at all the other soft tissues like your tongue, your cheeks, and underneath the tongue. So if you haven't been to the dentist in a while, this is your sign to come see us, because we can check for everything like that. We don't just look at the teeth and the gums, we're looking at the entire mouth as a whole.